Today's Medication Monday is Furosemide, also known as Lasix. This is one of the few medications that is equally known for its brand name as well as its generic name. People use Furosemide and Lasix simultaneously and interchangeably in conversation as well as in chart review. So important to know both of these names. It is a loop diuretic used to treat patients with edema secondary to heart failure, kidney disease, liver disease, and it's also a first-line defense against hypertension. It works by working on the loop of Henle. It inhibits the sodium-potassium chloride cotransporters in the loop of Henle, which prevents reabsorption of sodium, potassium, and chloride, which leads to an increased excretion of water, sodium, potassium, chloride, and other electrolytes. This is going to help decrease overall volume and decrease preload, helping those patients with edema. It does come with side effects. Because it is causing release of electrolytes, it can lead to hypokalemia as well as hyponatremia. And the primary concern with this is arrhythmia. So many times patients will be on a supplemental potassium pill to offset potential for hypokalemia. It can also cause dizziness as well as hypotension because we're losing volume, lethargy, as well as weakness and muscle cramping. From a PT perspective, it is super important to be assessing vitals, specifically blood pressure due to hypotension, and blood pressure with change in position for the potential of orthostatic hypotension. If this patient is on telemetry monitoring, we should be monitoring EKG because there is risk for arrhythmia. And we should also be aware that this person is likely on tight I's and O's. So if your patient has to urinate during your session, that you are making sure that is being measured during your session. So there you have it. Today's Medication Monday is Furosemide.